Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
This show is going to teach you a lot about a subject you probably don't know much about, but in the event you or one of your loved ones needs it, I am so glad that we have TERRIE Delbridge, who is going to really inform us about wound care, about hyperbaric therapy, hyperbaric oxygen therapy, and what this great hospital was called, really, is Memorial Health Hospital. They have so many of them, but this particular one is at Pembroke that they have this. So with that, TERRIE, I want to welcome you to the show, and you're going to let a lot of people know why you get up in the morning and why you go to work.
Thank you so much for having me, and I'm so excited to tell people about the Wound Center and Hyperbaric Oxygen Therapy at Memorial Hospital Pembroke. And the reason we get up in the morning is knowing we make a difference in lives of many, many people. Some of them may be folks that are looking at possible amputations, possible decreased quality of life based on what we call chronic wounds. So at Memorial Hospital Pembroke, we offer a service that is for limb salvaging, meaning that we have advanced therapies that will allow us to hopefully prevent loss of limb and increase quality of life. And that's why we get up every day, is to make that big difference in someone's life who possibly thinks, that there is no hope. And we give hope to these patients at Memorial Hospital Pembroke Wound Center.
And I'm glad you mentioned diabetes, because isn't that one reason why people wind up with major wounds and even amputations?
Absolutely. Unfortunately, when you have diabetes, you have a condition called neuropathy sometimes, and you really don't have feeling in your feet. You may have symptoms of numbness or tingling, but you do lose that sensation. So you may have injured your foot or your toe or even your lower leg and not even realize you have a problem until you start running a fever, you start having pain that you weren't having, you start having redness, drainage, just all kinds of complications, and you don't realize that you have a complication until you look down at your foot. And we encourage our diabetic patients to examine their feet, examine their legs twice a day, when you get up in the morning, when you go to bed at night, to make sure you're not having a problem. And if you are having a problem, we really encourage you to call Memorial Hospital Pembroke, to come to the Wound Healing Center so we can evaluate you and get early treatment going and prevent any kind of loss of limb, and to make sure you're getting the adequate treatment for a diabetic foot wound or a diabetic leg wound.
But now, when people have those wounds, there certainly must be pain, and it must be terrible.
Well, unfortunately, sometimes with your diabetics, they don't have the pain until it's much worse, and that's why we encourage them to inspect their feet. They want them to inspect their feet in the morning and then in the evening time, because sometimes when you start having the pain, you start having an odor from drainage, you start having those complications. It's really bad. So if you notice a cut on your foot, if you notice redness, swelling, drainage, even if you think it's something minor, we encourage you to call Memorial Hospital Pembroke Wound Healing Center, get an appointment, let one of our specialists take a look and get on to the advanced treatment early on before it is such a problem. And a lot of people do wait until they have pain. And with your diabetic patients, they don't always have pain until it's a severe condition.
All right, well, let's move out of the diabetic world. There are other people that they maybe slip and fall and cut themselves, and it doesn't heal. And most people, if they're in good health, things heal, don't they?
That's right. If you have a condition and you've had an injury, and I can tell you in our population of patients, a lot of times they'll say, oh, well, I just hit my leg on the car door, or I hit it on a coffee table or the dishwasher, and it was fine, and now all of a sudden I have swelling and drainage and a bruise and things that won't go away. Sometimes that's your first sign that you may have another condition. You're not healing because you have a condition that's not letting you heal. It's not so much the wound that you're not healing. It's because maybe you have decreased circulation in your legs, you have varicose veins, and you're not getting adequate blood flow, and all of a sudden you're not healing, or you're having a lot of swelling and fluid coming out of your legs. Even if you were to get a scratch or a little bump that you think isn't really healing or looking well, we ask that you call Memorial Hospital Pembroke, come in for an appointment, let one of our interdisciplinary team members, such as our nurses who specialize in wound care, or one of our panel physicians, to look at the wound and to see what the underlying condition is that you're not healing. You can have arterial disease, meaning your arteries are not working as well to get the blood flow or the oxygen to your legs, and all of a sudden you have a major wound problem. You could have a vein problem, maybe long-standing varicose veins, swelling, lymphedema, those kind of problems that you don't even know you have the problem until you get a minor injury that turns into a big injury. So we would rather you come in early, let our panel physician take a look at the wound and determine treatment.
Well, I am just absolutely appalled at an idea that somebody would not treat their wound, but I guess they don't realize the severity of it. Is that possible?
It is possible. It's very possible. Sometimes people think, oh, it's nothing. I don't really need to come to the wound center. That's for something much more serious. And then they wait so long that then they have a serious problem. As you get older, your skin does not have the elasticity that it does when we're younger, and you start to have vein problems or artery problems that you don't really realize you have until you have a wound. And sometimes a wound is your first indication. And we would rather you come in and we say you're perfect, everything's great, than not until something gets to be worse.
Yeah, I guess that is true. You have a great background. I know when I was talking to you, I said, did you ever know you would be in this field? Why don't you share some of that personal story? It was so nice.
Oh, well, honestly, I've been an RN for 30 years. I actually graduated from Florida State University. Go Seminoles, I can't help myself. And I got married shortly after nursing school, and we found ourselves back in the panhandle of Florida where I actually grew up. My father was in the Air Force. And home care was just beginning. And at the point when home care was just beginning, they were looking to market their services, and they needed someone to go to school to become a wound, ostomy, and continence nurse, which they now call WOCN. At the time, they called them ET nurses, which some people may know that name. But you had to have a bachelor's degree at the time, and I was the only nurse in the home care agency that had a bachelor's degree. And at that point, we were newly married, about 4 years, and we were going to start a family, but I really wanted to get more education before I made the family commitment. So when the home care agency offered to send me to Minnesota in the dead of winter for 2 months, I went ahead and did it. I had no idea what I was getting into. And I actually studied under Ruth Bryant, who was definitely a pioneer in the wound and ostomy arena, and loved it, absolutely loved it, and realized that it's not about wound care, it's not about ostomy care, it's about taking a patient who thinks their quality of life has greatly diminished and maybe it will never be the same, and leading them through the weeks of treatment to show them that they do have quality of life. We can get them to healing to where they're able to go back to their daily living activities. We have a healing outcome that is pretty close to 93-95%, if not higher, which is excellent. Excellent. I've been a wound care nurse for 26 years, and this Memorial Hospital Pembroke is definitely a superior place with all the nurses that we have available, with all the specialty doctors that we have available. So to take someone to heal their wound, to save a limb, it's very satisfying and very rewarding, and no regrets ever.
And when does someone need oxygen, hyperbaric oxygen therapy for a wound?
With our wound care patients, there's very strict guidelines with the insurance companies, but every one of our team members is very well versed in when a patient would need hyperbaric oxygen therapy. Your diabetic patients, again, come to mind. They do have to have a wound that there's a certain grading scale that I would not expect anyone to really know what that is, but that is part of the criteria. So when a wound is bad enough, a diabetic wound, and all other treatment has failed, they are definitely a candidate for hyperbaric oxygen therapy. And we call that an adjunct therapy. It's a therapy in combination with them coming to the wound care center on a weekly basis to see our doctors to promote wound healing. And the patients actually go into the hyperbaric chamber. They're breathing 100% oxygen to increase that blood flow to the wounds. The other conditions that we would do hyperbaric oxygen therapy would be patients that have an arterial disease or a mixed disease, meaning if you think about your arteries and you don't get adequate blood flow, things that don't get adequate blood flow die. So your tissue or where your wound is will actually die. A lot of these patients need to have some kind of what we call vascular workup first, meaning they literally have to go in and get the blood flowing again, so to speak. And then we would put them in hyperbaric oxygen therapy to get even more blood flowing going to the wounds and to get those kind of wounds to heal as well. We do oxygen therapy. We have patients who maybe have had flap surgery.
What's that? What's flap surgery?
Flap surgery is a patient that would have had a pressure ulcer, meaning that they're bed bound and they've developed maybe it's a bed sore. We call it pressure ulcer, but people would maybe think of it as a bed sore that the physician, like Dr. Shacken, whose specialty is plastic surgery, would go in and actually take a muscle and flap that wound closed. And if that flap, what's so-called failed, meaning it didn't get enough oxygen, they would certainly qualify for hyperbaric oxygen therapy as well. We also have patients, sometimes you have wounds for a long time and you maybe have a wound that's had bone exposed, so to speak, and they get what's called a bone infection, which we call osteomyelitis, and they've gone through IV antibiotic therapy and they're still not responding, then we would do hyperbaric oxygen therapy for them at Memorial Hospital Pembroke as well. You may have a failed flap from a patient that maybe had a mastectomy and they did what we call a transflap to rebuild that area on that patient, and sometimes those areas fail. It doesn't get enough oxygen, so they would qualify for some hyperbaric oxygen therapy at Memorial Hospital Pembroke. And then you have some patients that unfortunately their wounds have gotten so bad with their diabetes and they don't realize there's a problem, and when they come to the hospital, they may even have a condition called gas gangrene, which at that point they need hyperbaric oxygen therapy as well as some surgical procedures to get rid of that gas gangrene, because the hyperbaric oxygen therapy will actually kill the bacteria for the gas gangrene and help with the wound healing as well.
Oxygen is magnificent, isn't it? But it's very controlled, and I know that when I was there, I was watching Cesar, who is the technician, sitting there and controlling everything because it could be dangerous if it's not. I mean, it has to be done with the technician. People can't just start taking oxygen, free for all. They have to. It's a very big medical specialty.
It definitely is, and you definitely have when we have two patients in our hyperbaric chambers, we have one person here assessing the patient constantly, making themselves available if the patient needs to talk, making sure there's no complications. And we do have 3 chambers, so we can have 3 treatments going at one time, and we at that point have an extra nurse who comes in and assists as well. And then you have to have a hyperbaric doctor in the clinic on the premises also supervising the hyperbaric treatment at Memorial Hospital Pembroke. So patients, they look at the chamber and it may be a little frightening at first, but there's someone always here. The treatment works. They have the ability to watch TV. The nurses can talk to the patient via the telephone. So there's always someone here. These staff members have gone through extensive hyperbaric training, as well as the physicians. And it's a very controlled environment, but it's a very peaceful environment, and it's a very satisfying environment because as they're breathing in that oxygen, as they're getting that treatment, that they are getting better.
Yeah, it's a lovely thing. And I have to tell you, and I don't know if I mentioned to you, but I have worked with Dr. Shatkin before, and he's a genius. Oh, yes. Of course, as a plastic surgeon, I was working with him in that capacity. And now for you to have him as your the medical director there, you're very fortunate,
Oh, we absolutely are, because having Dr. Shatkin here on a full-time basis just adds to the program, adds his expertise, adds his ability to just as leadership for the clinic and for all of the memorial hospitals. He goes to all the hospitals on consults. He works with the other wound care teams, the inpatient wound care teams, other physicians, because our main goal is to work with the patient's physician to get their patient the best treatment available, and to have Dr. Shatkin as a consult person at all times has really benefited the center. We're getting more patients into Memorial Hospital Pembroke to get the care that they need, and we're tapping into a population that possibly did not know that we are here. Memorial Hospital has many hospitals, but Memorial Hospital Pembroke is the only outpatient wound care clinic. So our goal now is to take a patient that's possibly in the hospital, either they went in for a wound complication or it was discovered while they were in the hospital that they had a wound that they were not receiving treatment from prior to the hospitalization. So our goal is to get them from the hospital to the outpatient wound healing center and to get them healed as quickly as possible, to assist their primary care physician or their specialty physician with that part of their care, and then let the patient be returned, to those physicians for all their other health care needs.
Well, Terry, listening to you, you make me very confident about whatever they're doing there. You're actually what they call the clinical manager of the Memorial Center for Wound and Hyperbaric Oxygen, right? And
I am.
It's amazing and I know when I met you, you're so enthusiastic. And do you have any stories that people, don't give names, but some things that were really interesting that you've seen happen there?
I've seen a lot of exciting things. I've been with Memorial Hospital Pembroke Wound Center and Hyperbaric Therapy for 12 years. I've been the clinical manager for almost 9 years, and we are a very large practice that does a very excellent job on many patients. We've had patients that maybe have a workers' comp injury. We had one recently that had a crush injury due to an accident, a young man who was injured pretty severely and definitely made a difference in his life. This patient is healed now. He has one more surgery to go through, not for the wound, but for something else based on the crush injury. This patient went from just being miserable to worrying about whether he was even going to have a leg, to where Caesar convinced him to do the hyperbaric treatment therapy for the crush injury, which is another reason to do hyperbarics, to where the nurses took such good care of this patient. He came weekly for his wound care treatments. Dr. Shatkin did a fabulous job, and this particular patient's now healed. He's looking at possibly one more surgery and probably will be able to go back to work after the new year. And this is a young fella. We've taken children that have acute burns, and we had a pediatrician's office who was literally going to have the patient go to be admitted into the hospital to a burns center. And we just happened to talk to them, and they called them and told them to turn around, come back to the wound center to see what we could do. And Dr. Shatkin got that little boy to heal within 2 weeks. He did not need hospitalization. Children in hospitalization isn't always the best option due to It's a scary environment for little children, for their parents, for the families, and there's always risk of infection when you're not in your own home environment.
Sure.
And school was just starting, and so they really wanted to get this young man healed. He did beautifully. We had him healed within 2 weeks. We had another patient that really comes to mind. This particular patient was actually doing help in Haiti for earthquake.
Oh,
and,
really?
He actually contracted malaria, and the treatment for the malaria, of course, they flew him back to the United States. He was in the hospital, and he had treatment to reverse the malaria. That sometimes your treatment can cause complications that are not pleasant. And he was throwing what we call blood clots. And when you have blood clots and you're throwing those blood clots, you can cut off the circulation. And remember, again, when you don't have circulation, you don't have oxygen, areas of the body die. And he was looking at amputation of both legs.
Oh, no.
And they transferred him to Memorial Hospital, Pembroke. He was inpatient at another hospital, and I honestly don't remember. That was a while ago. I don't remember which hospital. And the transfer occurred mainly so he could go through the hyperbaric treatment. And he came to this hospital. He got excellent care on the inpatient side of Memorial Hospital, Pembroke. We saw him in hyperbaric treatment, hyperbaric therapy on a daily basis. He went home. He came daily for outpatient therapy, and instead of having bilateral amputation of his legs, I believe he only had a partial amputation of a toe and maybe some of the side of the foot. And to this day, he's able to run. He runs. He still does excellent work, volunteer work in Haiti, and is a active pastor in the community. And to me, that story was just simply absolutely amazing that we were able to help this man so much.
Well, now I know why you can sleep well at night. When people come in, they have no idea probably how serious things are, or they're scared to death thinking that they are going to lose their limbs or whatever they have. Whoa, that's really interesting. Have you ever been in a hyperbaric oxygen unit?
I have not.
No.
I have not. Some of the girls have because they went to extensive schooling, and part of that schooling was to get into the hyperbaric chamber. When I went to the hyperbaric program, they did not offer for us to get in there. So, no, I have not been in there. But I know every one of our staff members, whether they've been in there or not, they are so encouraging to patients, especially when they're a little bit frightened or maybe they're a little bit claustrophobic. We have ways to help them through that process and encourage them. And Caesar does a fabulous job of making them feel comfortable, of encouraging them. And since Caesar has come, the patients come to their treatments, even when they're a little bit scared or frightened. They are in such a nice environment that they want to come, and they see the benefit in the treatment at Memorial Hospital, Pembroke. Right.
Oh, you're absolutely right. And I haven't, my mother, I know that my mother was in her 90s, and she did have Alzheimer's, but she did have a wound. But they treated it. Someone came every day and just treated it. Maybe it wasn't as serious as what you're talking about, but I wish at the time, it was a whole year. It was a lot of trouble. And my mother was, it was not easy. But if I had wanted her to be treated, would I have just been able to get some sort of a van, a medical van, and get them to drive her down there and have that done?
As far as a wound care appointment? Yes, definitely. We see our patients within the same week that they call us. We try to see them within the same day or the next day because it's that important for them to come in, be evaluated, and start treatment. And honestly, our average healing time is 12 to 14 weeks from when they come into the center. And we multiple times hear patients say, oh, my goodness, I've had this wound for years, and you guys have healed me in a month, 2 months, 3 months. It's just fabulous when that happens, and it happens a lot.
And the value of oxygen, hyperbaric oxygen tanks, there aren't many around. I think when I was talking with your staff that there may be one in Miami, and I'm not sure about that, but you have a rare situation where you have 3 hyperbaric oxygen units. You have a full staff. You have, of course, Dr. Shatkin, who I'm so impressed with. So I would say you may be the best thing going in South Florida.
I absolutely think so. I think with our interdisciplinary team, with the setup that we have with the 3 hyperbaric chambers, we have the capability of doing a treatment on 3 patients at a time, which makes our day, we can have a full day of treatments, and knowing that we are helping people in South Florida. It's fantastic, and I would encourage anyone, even if you don't think you have a problem, call, talk to us. Let's get you in, get an evaluation, and hear from a specialist that we can help.
Okay, and let me just now give a phone number because I think it's important. The phone number to call would be 954-883-8014.
That's correct.
954-883-8014. And that way you can talk. Of course, hopefully you will talk to our star here, TERRIE Delbridge, but anyone can help you to make the appointment. And do you get recommendations, though, referrals from doctors? Is that how people wind up coming there?
Absolutely. We get referrals constantly from other doctors, even other hospitals outside of the Memorial System, within the Memorial System. Home care agencies, a lot of patients have home care, and those nurses a lot of times refer to the Wound Healing Center. And if you're not sure if your insurance covers the Wound Healing Center and hyperbaric oxygen therapy, we do have a insurance person who will work with you to get that referral, to get you in as soon as possible. If you have straight Medicare, you can be a self-referral. You can call, make the appointment. We have the staff. Margarita is our full-time office person who makes the appointments and makes sure that the insurance is checked, and she will do her best to get you in as soon as possible.
Well, I have to tell you, you've done a great job here doing it by phone. TERRIE, you're there in Pembroke Pines, and we thank you so much, and we look forward to more of these. Thank you.
Thank you so much. Take care.
You too, TERRIE. Bye.
Bye-bye.